now that we're focusing on tobacco taxation. I think that we are dealing with a very strange beast in terms of policy. And when I'm saying this, I have a few reflections as a practitioner that I want to share with practitioners. I want to share with you a few, thank you, thoughts as a practitioner and among practitioners. When I'm saying practitioners, I'm saying people who are not strictly tax specialists, but we are either tobacco control advisors or program managers or perhaps advocates or activists, and we all deal with taxation issues. We all belong in a community of tobacco control practitioners, and we have, as such, a set of assumptions we work with and we share with others. So probably before, during, and after this presentation, it would be a great thing if we could think and rethink about these assumptions. For instance, tobacco tax is very hard to handle because no politician on earth has the instinctive nature to raise taxes. And so therefore we have an uphill battle to convince policymakers and legislators that tobacco taxes should be raised. But at the same time, it's a land of opportunities that usually arise from some sort of mishappening for other people. And I'll give you two examples. We have a situation in, for instance, in Brazil, where we're trying to get a tax-based specific tobacco control fund that legislators are still considering because of the dire straits of the Brazilian economy. It would not be the same if we did not have this window of opportunity. And this situation is very specific. We have another subnational jurisdiction here in the Americas. It's quite confidential at this point, so I can't reveal the name, but that is seriously considering special contribution, non-tax special contribution to recover costs from the public health expenses related to the tobacco disease burden. Why? Why would they want to do this? Because again, the economy of that subnational jurisdiction is in very bad shape. And so they're willing to consider any source of income whatsoever. Is it out of conviction, a public health conviction? I'm not so sure. But there is certainly the case that we as practitioners should consider this window of opportunity. And then there are other questions that will obviously always haunt us and come back to us, like if the first stumbling block to raising taxes in places where they have done this before is the argument that tax raises increase illegal trade and the size of the legal market. So we think this is an industry argument, and the only evidence around is industry evidence, industry-based. However, we need evidence to oppose, and that evidence may or may not confirm to a certain extent what the industry is saying. So we have, for instance, Roberto Iglesias here, who has done quite a bit of research on tobacco control and the effect and the impact of tobacco taxes on the illegal trade and illegal market in Brazil and the Mercosur region. There is another situation, for instance, what happens when tobacco tax increases, but the prevalence does not respond to that increase. And we have a case right now here in Mexico, unfortunately, since 2009, and between 2009 and 2016, according to the GATT survey, prevalence in Mexico has remained more or less the same. We had a very important tax reform in Mexico, not the best in the world, but a good tax reform and tax raise in 2010 and 11. So the industry is now saying, why would you want to raise more taxes when we have evidence it hasn't worked in Mexico? So we need evidence to counter those arguments. And we have Rosa Sandoval. And Rosa is the regional advisor for tobacco control for PAHO. And she specializes in seeing what happens across the region in terms of taxation and its impact. And the same we can say about Guillermo Paraje, who works in Chile, who is an academic, and who's done research into the impact of tobacco taxation in prices and revenue, the other big component of the outcomes around tobacco control and taxation. So without further ado, I'm going to give the floor to Rosa, who's going to share her evidence and her experiences from across the region.
Good afternoon. I'm going to try to speak not that loud because usually most speakers have the problem of being asked to speak louder. I have the opposite problem. People ask me to speak not loud, please. So in the other room, apparently, they were hearing us. So if you cannot hear me, let me know, and then I will speak a bit louder. But I think this is fine. Can you hear me at the end of the room? Yes? Okay. Thank you. Okay, so thank you, Jorge, and thank you to my colleagues in the union for inviting me to make this presentation today. I'm a regional advisor on tobacco control at PAHO, WHO, and I've been working for the last 13 years in among other things, in monitoring implementation of the main tobacco control policies in the region of the Americas. So Jorge asked me to provide an overview of the progress made in the region of Americas in increasing tobacco taxation since the FCTC became an international treaty, since the FCTC entry into force in 2005. And, but also provide an overview of how this fits within the progress made in other tobacco control policies in the region. So that's the goal for my presentation today. And so first, I have no conflicts of interest in terms of doing this presentation today for you. The content of the presentation, I'm going to basically speak about two things. First, what has been the progress made in the countries of the Americas in implementing key mandates of the FCTC. I will focus on the time-bound articles. For those of you who don't know which are those articles, these are Article 8, that calls for banning smoking in all indoor public places and workplaces. Article 11 that calls for adopting strong, large, and with graphic images, health warnings on all tobacco packages. Article 13 that calls for banning advertising, promotion, and sponsorship of tobacco. And also I will add Article 6, which is the topic that convenes us today, that calls for raising tobacco taxes. And then I will open up the conversation in terms of what's my vision, what has prevented, or what are the challenges for the region in terms of moving forward in increasing tobacco taxes. So what has been the progress made in the region since 2005? First, since 2005, 19 countries in our region. Our region is comprised by 35 member states. 19 of those 35 member states have approved laws banning smoking in all indoor public and workplaces. The last one in joining the team is Guyana. Guyana approved a comprehensive tobacco control law on August 22nd, just last August 22nd. So it's a new country that complies with this mandate in the region. 17 countries have implemented large and graphic health warnings. Article 11, again, Guyana includes that provision in its new law. And 6 countries have adopted a total ban on tobacco advertising, promotion, sponsorship. Guyana also included in its law this provision. So now we have a number of countries that have implemented a number of tobacco control policies. But we only have 2 countries that apply taxes represented at least 75% of the final price, which is the benchmark that WHO uses to measure progress in implementing tobacco taxation. And I'll come back to that issue again. I'm just highlighting the 2 there. It's just a few countries if you compare it to the 19 in smoke-free laws, 17 in health warnings, 6 in banning advertising, promotion, sponsorship. And we will also have a bit of a conversation, and I hope a long conversation on the indicator per se that we're using to measure progress on tobacco taxes, which, as I said, is whether countries are implemented taxes that represent at least 75% of the final price. But I know Guillermo has some comments about it, and I'm looking forward to discuss with him and all of you more about this. And so, as an overview, if we were to color each country that has a tobacco control law complying with the FCTC on Article 8, 11, and 13, if we color it green for those countries that have implemented the law, and we color it yellow for those that have implemented some of the provisions, but it's not comprehensive, and in green, and in red, those that have not implemented the mandate, this is the situation before the FCTC between 1999 and 2002, when the FCTC was being negotiated among all member states, all WHO member states. So basically, no country in our region had a tobacco control policy complying with what the FCTC says in Article 8, Article 11, and Article 13. This is the situation now. So as I said, in green are those countries that have a law complying with the FCTC, Article 8, Article 13, and Article 11, and Article 13. And you can see there also how those 19 countries that have laws on smoke-free environments mean that our continent is greener when it comes to Article 8. It's a little bit less greener, but almost as green when it comes to Article 11. And in Article 13, we do have much more work to do. You might remember that I said only 6 countries have a law complying with Article 13. So that's the situation with the time-bound FCTC commitments. So far, we can say that there's a remarkable progress in terms of basically 2 time-bound mandates, Article 8 and 11. Many countries in our region now ban by law smoking in indoor places and workplaces. Many countries have large graphic warnings on tobacco packages with images. There's less progress in terms of banning advertising, promotion, sponsorship, and we could have a whole session just to discuss why there's less progress on that. I can just tell you in a very, my appreciation from being involved in efforts to pass laws on this regard is that this is one of the things that the tobacco industry has fought the most. In some occasions, when there were tobacco control comprehensive laws being discussed, they negotiated that the law would include a provision in Article 8 and a provision in Article 11 as long as it would not include Article 13. So in some occasions, that has been the provision that has been left aside in order to pass the other ones. But then I want to ask the question, is this progress really remarkable? 19 countries, 17 countries? No. And how about taxes? So I show you the 3 maps, and it was all in red before 2005 in terms of implementing these 3 articles, right? 8, 11, and 13. But if I put them together and I count the countries that have implemented 1 to 3 tobacco control policies, I'm measuring here progress in 6 policies. Aside from the 4 that I've been mentioning so far, we also measure whether countries have in place measures to monitor the tobacco epidemic, for example, whether they have representative surveys that are applied periodically to measure the tobacco epidemic at national level, that are representative periodically, etc. And the 6th measure is whether they offer cessation services. So those are the 6 measures. You might have heard about them. These are the empowered measures that we monitor regularly. And so if we add them together, we see that only 7 countries in the region in 2005 had implemented between 1 to 3 of those 6 measures. And 80% of the countries here had not implemented any of the 6 measures, and including those that I've mentioned before, the 3 time-bound ones, plus taxes, monitoring, and cessation services. 80% of the countries, when the FCTC became international law, had not implemented any of those policies. And this is the situation now. Of course, we see the progress. Now, we have 40% of the countries that do not implement any policy, but we do have a number of countries here that implement between 4 to 6 of those measures. So they're close to having a comprehensive tobacco control package in place. And we have a group of countries that around 37% that implement between 1 to 3. But still, 40%. over more than 10 years after the FCTC became international law, 40% of the countries in our region do not implement a single tobacco control measure as established in the FCTC. So as I said, we can be very happy about the remarkable progress about the 19 countries that have banned smoking indoor, but we also can be very concerned about the fact that there is a number of countries that, although the evidence is overwhelming about the effectiveness of these policies, they have not been able to implement them. As I said, half full or half empty glass. Your choice, you can say it the way you prefer. I prefer to see it half empty, because I do think that there are at least two policies, smoke-free environments and health warnings, that are within the competence of health authorities. The evidence is overwhelming. They can implement it. It's politically viable to implement them because 19 countries in our region have shown that it's possible to implement them. So why they are not in place? They should be in place tomorrow. There's no reason not to have them in place. But now, let me go to taxes. So that's the overall context in how the region is moving in terms of tobacco control. Let's go to taxes now. This is the situation in taxes. As I said, we use as an indicator to measure progress whether a country has reached taxes in the country's account for 75% or more of the final price of the most sold brand of cigarettes in a country. That's our indicator. We see that only two countries in our region have reached that benchmark. That's Chile and Argentina. And we see that most of our countries are in the middle. So, and I'm gonna, since Guillermo already told me during breakfast what he's gonna say about the indicator, then I have the chance to respond to him before he critiques the indicator. And, so it's true that, that these countries might feel that there is nothing else to do because they have already reached 75%. But what it's also true and a matter of concern, I believe, for all of us is that most of the countries in our region are very far from that benchmark. And the evidence, again, is very robust in terms of how tobacco taxes are effective. But I'll come back to that later. And sorry for the Spanish there, I forgot to change it. So, ¿qué buscamos? What do we aim for? What are we looking for? What's our goal? So when we're discussing about tobacco taxes, what is it that we're talking about? We are talking about making tobacco less affordable, right? That's what we want, that tobacco is more expensive, that it's more difficult to buy tobacco, to afford tobacco. So we want higher prices. But we also need to look at the income levels because we do want the population in our countries to have access to more income. We want salaries to go up. That's part of a country growing up and to increase the well-being of the population. But if we have more income, that means that tobacco becomes more affordable. So if we want to make tobacco less affordable, we need to look at both. How much does tobacco cost, but also how much money does the population have in their pockets, whether the country is growing economically or not. And the policy tool that we have to alter this scenario here is taxing tobacco. And this is why we are discussing this topic today. The goal, of course, is to reduce affordability. Tobacco increases need to translate into higher real prices. That prices are higher than the rest of go higher than the rest of the prices, the prices of the rest of the goods in the economy, and that they are higher than increases in real income. So what has happened in the Americas in terms of that scenario? Questions that we need to ask ourselves. Are tax rates going up or down? Are tobacco prices going up or down? Are changes in prices due to tax policy, or are they a reflection of what the industry is doing in terms of price policy? And finally, whether tobacco products are becoming more or less affordable. To answer these questions, I'll attempt an answer to these questions based on data that WHO collects every 2 years for the WHO report on the global tobacco epidemic. This is by no means a comprehensive analysis. It's looking at the data at 3 types of indicators that we collect that can give you an overview of what's going on worldwide in terms of taxes and prices and basically tobacco tobacco products becoming more or less affordable. So we have three indicators in that report. And as Guillermo and I were talking earlier today, for us to monitor whether tobacco is becoming more or less affordable, we need to have indicators that can be collected for 193 countries in the world, and that can be collected in a relatively easy and quick way. Otherwise, we cannot present a global overview of the situation. So what the report has, we calculate a tax share based on the laws and decrees applying of taxation applying to tobacco products in each country. We calculate a tax share. Then we collect an international price of the most sold brand. We also collect the price of the cheapest brand in each country and of a luxury brand, which in many countries means Marlboro. And what we publish is international price based in international dollars. And we're publishing too an affordability index, which is the percentage of GDP per capita that is required to buy 2,000 units of cigarettes or 100 packages of 20 units. So what we see, the report was published for the first time in 2008 using 2007 data. And the new report has been published last July with 2016 data. So this is why I'm comparing 2007 and 2016. And this is the situation. What we see is that the tax share has gone up in 24 countries. So the indicator that we use, right, the percentage of taxes that out of the price of the most sold brand in each country, that percentage, that tax share has gone up in many of the countries. But when we look at how much it has gone up, we see that only in 9 countries out of the 24, the increase was above 10 percent points. And this is arbitrary in terms of 10% points or 15% points. My message here is that most of the increases were not that large, were small increases. And this is something that needs to be taken into account. We have many countries that have tried to increase taxes, that were successful in increasing taxes, but how big was the increase? And of course, the increase needs to be big in order to have an impact on consumption, which is something that Jorge was mentioning earlier, right? And as a general rule, I think we usually expect Guillermo and Roberto prices to go up in 20% to expect a change in consumption patterns. So if the taxes didn't go, increasing taxes are going to move up the increase in prices. So we need taxes to go up significantly as to generate an increase in prices of at least 20% to expect some change in consumption patterns. And what we're seeing here is that most of the increases were not at that level. Another way at looking, another way at communicating that the tax increases have not been really high is when we see in which category each country is. So for a country to be in the green category, the tax share needs to be 75% or above. If a country is between 50 and 75, it's yellow. If it's between 25 and 50, it's orange. And if it's lower than 25, it's red. So if you see at the two maps, for these maps to show progress, we would like to see that the colors are changing, right? That countries are moving towards green. But we don't see much change. The pattern of the colors is very similar, which means countries have not moved up in categories. And you can see there in the text, again in Spanish, that out of the 24 countries that increased the tax share, only 5 countries were able to move up in a category. Again, this is arbitrary. A country maybe moved up because it was previously at the level 48, and just because it became 55, move a category. And another country could have been in the level of 26 and move up to 49, and it's not going to show there. But these are just different ways of communicating, of looking at ways that the data can show us how much the tax increases did not reflect in a significant change. So the first answer is, what's going on with tax rates in the region? Basically, they are stable, they are constant. Some countries have increased taxes, as we said, but the increases are not that big. So tax share in general are not changing in our region. How about prices? So in terms of prices, this is the different level of prices in the region, the price of the most sold brand in each country in the region of the Americas. The first thing you can see there is that prices change a lot from country to country. There are countries where the price is very low and countries where the price is very high. And I will take with caution the data from Venezuela for obvious reasons, but traditionally Jamaica has been the country where the prices are higher since we started collecting this sort of data. And the situation again has not changed. You know, the dispersion in terms of the prices is a constant since 2007. So are tobacco prices going up or down? So this is the situation. In blue are those countries where the prices have gone up since 2007, and in gray are those countries where we didn't have data. So what is this map showing us? That in all countries in our regions, prices of the most sold brand went up since 2007 based on the indicator that we collect. But again, prices have gone up in over 20% in 31 countries and over 50% in 18 countries. So prices are really going up in many of the countries in our region. So second answer, are tobacco prices going up or down? They're going up. So we have tax rates not changing, we have tobacco prices going up. Now, how about affordability? And as I said, the indicator we're using is the percentage of GDP per capita that is required in each country to buy 2,000 units of cigarettes. And here what we see is that in 15 countries, basically almost half of the region, there has not been a change between 2007 and 2014 in terms of affordability, measured the way I just said. And in 14 countries, tobacco is less affordable, which in a way goes hand in hand with the fact that in many countries prices are going up, right? So what's the summary? Tax rates are stable, constant. Many countries have increased tobacco taxes, but increases were small. Prices are in general going up, or are going up for most of the countries. Let me go to the last point here. And tobacco products are becoming less affordable based on the GDP per capita indicator. So what we see here is that prices are going up, tobacco is becoming less affordable, but it's not because of what we are doing with tax policy. It doesn't seem to be tax policy the factor that is changing this scenario in terms of prices and affordability. So I would dare to say then that in the region we are not using the policy tool, taxation, that we have to change, to modify affordability of tobacco products. We are not using it as much as we could yet. Why we're not using it? Some of the things that Jorge mentioned before are the evidence around taxation. Now, how to counter the common, typical, and recurrent argument by the tobacco industry that increasing taxes is going to increase illicit trade. The theory and the evidence and the global evidence tells us that it's not changing the tax structure is not when it's going to determine necessarily a change in illicit trade. However, the industry insists, and we need then to have a solid and independent estimation of tobacco illicit trade in each of our countries so that we can monitor it and we can respond it and we can put a final point to that argument. This is it. We have an independent number. We are not going to rely on any number that any advocate of the tobacco industry is going to come up with, and we're going to counter argument with measuring consistently illicit trade. There's lots of efforts in the region going on around that. There are countries like Colombia that have done that recently very successfully. Mexico is doing it, Chile is doing it, Brazil is doing it, Argentina is doing it. So those are really efforts that are going in the correct line around this. We need, I believe, more evidence on tobacco and poverty. We need to collect more evidence to link the results of tobacco control with the 2030 Sustainable Development Agenda. There is an impact of the tobacco epidemic in the development of the countries, and I believe we are not capitalizing as much as we could that argument, and in many cases it has to be with the fact that the evidence on tobacco and poverty is concentrating in a few countries in our region. There's evidence for Brazil, there's evidence for Mexico, but there's not much more evidence about this, about the link of tobacco and poverty in other countries in our region. Impact evaluations. We need to know, so what happened in Mexico exactly after the 2009 and 2010 tax increase? Just last December, almost a year ago, I was in a meeting with the Secretaría de Hacienda, the Ministry of Finance staff in Mexico, and one of the things that they said is that they don't have, and they would like to have an impact evaluation. So what happened after the 2010 tobacco increase with the tax rate, with the fiscal revenues, with the levels of consumption, and with the illicit trade? We need to have those answers for each of the countries that changed their tobacco tax structure. St. Lucia introduced a tobacco tax in 2012. What has happened since then? El Salvador introduced a huge increase also around those years. What happened since then? Mexico, Jamaica, Peru, Ecuador. We need those impact evaluations. And I'm sure in some cases there are some work, efforts going on. The Ministry of Finances usually monitor what's going on with variability in terms of how comprehensive that monitoring goes, but I think we need to have these impact evaluations published and disseminated, and we all know about them. Then, investment cases for tobacco control. I say it's another venue that we need to explore more, to have for our own countries a comparison. How much does the tobacco epidemic cost in my country? Not only for the health system. I think the EX in Argentina has done a tremendous job in terms of putting on the table how much the tobacco epidemic costs to the health system in about 14 countries in our region. It's really, it was unprecedented because it was the first time we had those sort of numbers that are comparable for many countries in our region. But we need to expand it, not only the cost to the health system, the direct cost, but the impact in productivity too. So how much does the tobacco epidemic cost to the health system, to the economy in general in a country, versus and compare that with how much does it cost to implement the 4 tobacco best buys, and communicate to the governments, this is the return of investment that you have in your hands. In those investment cases where I have been participated, the return of investment on tobacco taxes is amazing. It's like, you go with that to the Ministry of Finance and the person will be like, yeah, I mean, it's obvious that I have to implement this. The return of investment is clear. I think in Jamaica it's around 6. So for $1 invested in tobacco taxes, you get $6 back in not losing productivity because people getting sick or dying for diseases related to tobacco. It's a very good ratio. But a final word of caution as well. We can always come up with a huge list of evidence that we need to work on. But I just want to finalize this section saying that not having this evidence did not prevent us from the progress we have made in Article 8 and 11. Right? So it is so overwhelming, the global evidence on the effectiveness of tobacco control policies, and it's so overwhelming the cost that tobacco causes to societies, that we can still advocate for implementing tobacco control policies, even if we don't have this whole list of more evidence that we would need. But this can certainly help, but let's just not think that because we don't have this, we cannot move forward. And finally, in terms of challenges and how to move tobacco taxation forward in our region, we've been discussing this a lot with some of the people here. New voices, we need new voices at the international level. It's great that the World Bank is getting so involved in tobacco taxes. Just yesterday, they had a meeting, during the spring meetings in Washington, D.C., they had a session on tobacco taxes where 30 ministers of finance around the world attended, where the message was increase tobacco taxes. It's good to prevent future costs for the health system, and it's good for obtaining some revenues right now that can contribute to development, just like the Addis Ababa Declaration said last year, right? This is a source. Tobacco taxes is a potential source of financing domestically non-communicable diseases programs, or specifically tobacco control. We hope that the Inter-American Development Bank will join this chorus of voices advocating for tobacco taxation. And we hope also that ECLAC, CEPAL, will join this as well. We need all the different agencies with a voice in terms of economics topics to speak on behalf of tobacco taxes. And it's true that, I think Jorge said, it's difficult for a Ministry of Finance to accept, to see positively taxes. I think that can be changing, or that can change in terms of when we start talking about healthy taxes. There's a whole conversation about how tobacco taxes, alcohol taxes, and sugar-sweetened beverages taxes are healthy taxes because they contribute to reduce the impact of an epidemic and then be positive for finances and for health. But I think it's true that for any person working on taxation, that they will see excise taxes like tobacco, alcohol, or SAB taxes as taxes that are not that important because they are just a very small percentage of all of the fiscal revenues that they collect from taxation. Direct taxes, not indirect or excise taxes like the ones we are talking today, are the more important. So why would a person that works on taxation pay attention to something that means a little proportion of their work? And I heard Blanca Moreno Dodson from the World Bank saying how her first reaction when someone talked to her, this is a woman who works on macroeconomics, who works on tax reforms around the world, who is not involved in health at all at the World Bank. And I heard her saying, that her first reaction was that, why would I invest percentage of my time, which is so valuable, right, for the member states especially? She needs to be accountable to what the member states in the World Bank demand from her. Why would I devote time to a tax that is such a small percentage of the fiscal revenues? I need to work on income taxes. Those are the ones that are going to change the panorama of a country basically having more money or not to finance their programs. And she said, not because of the money you collect today, it's because of how much damage you prevent for the future. And that's the powerful tool about alcohol taxes, tobacco taxes, and SSD taxation, is to prevent disease that is going to come in the future, to make your health system viable from now into 20 years. And that's a message that we need to communicate more frequently. And finally, I know I'm going over time. And increase our collaboration with Ministry of Finances. There are really great experiences in the region, but we need to replicate those experiences like the one in Colombia, like the one in Peru, like the one in Argentina and other countries as well. And this would be the dream team, I think, if we want to have a successful campaign for increasing tobacco taxes. We need, depending on the country, we need, of course, a Ministry of Finance in those countries where the taxes are changed through a decree from the executive power. So we need the commitment from those designing policy in the Ministry of Finance, or from a Congress member, like in Mexico, from those countries where the increase needs to be approved by Congress. We need the Ministry of Health supporting, advocating, and providing leadership in terms of how important this measure is. We need, of course, civil society, national and international advocating. We need a national expert, a researcher, someone who can say, I spend my life researching on this, and this is effective. And this is just what the evidence is showing. We need international experts, of course, which we have, and we need institutional positions by international organizations, talking on behalf of tobacco taxes. And I think we still have work to do in terms of involving the Inter-American Development Bank and the IMF. And that's it. Thank you.
Thank you, Rosa. I know I said we would do a round of questions to each speaker, but I'm afraid we may not have enough time for the other two speakers. So we'll go back to the previous format. We'll, each one will present, and then we'll have a final round of questions and answers. So Guillermo is now going to make his presentation, and I think part of it will be devoted to a dialogue with Rosa around at least one of the indicators she presented.
Thank you very much. Okay. Yeah. Thank you very much to the Union for giving me the opportunity to present at this meeting. I do not have any real or perceived direct or indirect conflict of interest that is related to this presentation. And what I'm going to present is some evidence for the region, for some countries in the region, about the effect that higher prices do have on consumption. And by higher prices, we hope to capture also the effect that increased in taxes do have on consumption. So we have a lot of evidence for many countries, developed and developing, before and after, about the effect that tobacco prices have on consumption. In fact, we know for at least 500 years that prices do have effect on demand, on all goods, not only on tobacco. This is a very simple graph. This is the increase in real tobacco price in Chile in the last 14 years, since from 2001 to 2015, and this is youth month prevalence of tobacco use. In Chile was really high, was one of the highest in the world. By 2001, we had about 42% of youth that were smoking monthly in Chile. There was an increase in prices, and I will talk about this a bit later. Some of that increase in prices was caused by taxes. Some other part of the increase in prices was caused by industry policies, and we have to consider also that. But what we see is that there was a quite steep increase in real tobacco prices, and also there was a steep decrease in youth smoking prevalence. Basically, we managed to almost decrease by half the youth use of tobacco. In between, there were also other policies like smoke-free environments and an increase in labeling, in warnings, and many other policies that do also have an effect on this. But we know, for studies we have conducted, that the main policy behind this decrease is related to taxes. On the other hand, we have the situation in Argentina, where this goes from 2005 to 2011, which is the range of surveys I did have at the time to compare prevalence. We know that prevalence was basically constant. This is adult prevalence from 16 years old to 65, and was constant around these years. And the real tobacco price in Argentina was also constant. Afterwards, in 2016, there was an increase in taxes that changed a little bit, and we all want to see what happened to prevalence. We expect that prevalence would fall, in part because of that increase in taxes. But this is basically pictures very graphically the situation of a country that basically did not change taxes and prices for quite long. So we know that individuals are sensitive to price changes, even for addictive substances such as tobacco. We know that because of the studies that have been conducted in the last 12 years, 13 years in the region, that the demand price elasticity in the region, which is consistent to the price elasticity in other parts of the world, is about minus 0.45, which means that a 10% increase in real tobacco prices would decrease demand by 4.5%. That's basically the meaning of the demand price elasticity. We know, because of the studies conducted in other regions, but also because of the studies conducted in Latin America, that taxes and price increases are effective to decrease consumption, reducing intensity or promoting cessation. And to me, more importantly, they play a big role in preventing initiation. And that is something that usually in the cost effectiveness studies that are considered to, that are done to consider the effectiveness of tobacco taxation, these things are usually left. I mean, how many individuals do not start because of higher prices caused by higher tobacco taxes? A study by Guindon for Argentina shows that, for instance, a 10% increase in real tobacco prices controlled by, in this case, other policies like smoke-free policies, the implementation of smoke-free policies in Argentina. So the increase in, a 10% increase in real tobacco prices, there is a mistake there. So a 10% increase in real tobacco prices decreases the risk of initiation by 5%. So basically, an increase in prices means that the risk of initiation decreased by 5%, meaning more or less that half of the people that would have initiated smoking do not initiate because of that. And we know also that initiation, tobacco onset, is basically quite strong in a very specific moment of life, between 15 and 20, 25 years old. If you don't start at that time, you don't start. So basically, that is a policy that is concentrated in that age group, and it is quite important to consider that. This, the impact of prices on smoking onset is stronger in the case of Argentina for women than for male. In the case of Chile, in a paper that I haven't managed to publish yet, and that I presented in the last meeting of the union in Liverpool, we found something similar. A 10% increase in real tobacco prices in the case of Chile decreased the risk of initiation by around 4.5%. Very similar. There is no reason to believe that these figures would be different in one country than in another. And in a similar paper for Argentina, González Rosada and Montamat find that a 20% increase in real prices would delay initiation by 3 years, which is another way of looking at this result. And again, because tobacco initiation is very concentrated in a specific age period, this delaying would mean that many people won't start at all. So we know that this policy works in terms of either reducing consumption, and we have this elasticity for the region, which is about minus 0.45, and also prevents initiation or delays initiation. We also know that increases fiscal revenues, something that, honestly, I'm not very fond of this part of the effect of taxes, again, because it's too little, but that is what Ministries of Finance wants to know, how much we are going to increase revenues because the increase in taxes. Contrary to some claims about the industry that tax increase would increase contraband and will not increase fiscal revenue, we have observed in the region that tax increases have increased revenues, in some cases very importantly. In the case of Argentina, there was an increase of more than 55% in nominal revenues, which discounting inflation would mean an increase by more than 30% in revenues because of the taxes. We also know that for Peru. In the case of Chile, for instance, in the last years, we had 2 moments of tax increases in 2010 because to finance the reconstruction of from our last big earthquake. And we see that quite a small increase in taxes increased revenues, and I'm going to talk about that a bit later. And the last one in 2010 and 2014, it also increased revenues by around 15%, quite importantly. So we know that taxes also increase revenues. But taxes are only effective, as Rosa mentioned, if they reduce affordability. They have to increase prices at a faster pace than incomes are increased. And in that respect, Colombia's provision of a semi-automatic tax increase, which is inflation plus 3 points, is a very good idea. And it's something that should be probably implemented or at least proposed in many countries. It's a very good initiative to avoid that inflation, for instance, and increases in income erode this affordability. And also we have to consider that taxes are effective if they are passed to income, to prices. And in this point, we have to consider the competitive landscape of the tobacco market in each country. Because the tobacco industry or firms can choose whether to fully pass taxes to consumer, to have a pass-through that is lower than 1, meaning that they pass to prices less than the taxes, but they can also choose to pass more than the taxes. So basically, if taxes increase 10%, they pass to prices more than 10%, which is very common, and which means, first, that they are not that concerned by contraband. Yeah? Because if they choose to increase prices by more than what taxes have increased, contraband is not a problem for them. Yeah? And more importantly, means that somehow we have, or the countries have implemented a tax increase that is too low. They could have increased taxes by more. They could have forced the industry to increase more the prices because they are willing to increase the prices anyway, because of the competitive landscape. The other thing is that we cannot expect taxes to solve the tobacco problem by themselves, only by themselves. We know that it's the single most cost-effective policy to decrease consumption, but it's not enough. Sometimes we need to implement other policies. Rosa made an excellent point in showing how different policies have been progressing in the region. All these policies help to decrease consumption. So countries do have, and we as advocates and as researchers, we do have to propose tax increases, but we don't have to forget that the other policies also help, and that taxes are not the only policy. And in this respect, I think that 2 policies should be considered. First, the minimum price policy, and the other one is minimum selling quantities. We have to somehow force the companies to avoid selling by the units, and to force them to sell, for instance, 20 cigarette per package. Again, that reduces affordability and decreases consumption. Again, we always hear the usual arguments against raising taxes. First, that taxes are regressive. False. We already knew that they were false, but a very recent study by Fuchs and Meneses from the World Bank shows that in the case of Chile, for instance, taxes are actually progressive because save more money in terms of avoiding future health costs to the poor household than to the rich. So if we consider the whole picture, not only the revenue, the tax or the impact on incomes, but also the impact the impact on expenditures, and consider both, taxes are progressive, save money to rich people. And the other one, that taxes increase contraband, and I said something like that before. Why contraband is a problem only when taxes are increased and not when monopolies or duopolies or oligopolies increase their prices to collect more money, to increase firm companies. And again, I go back to this graph in Chile. In this period, from 2006 to 2010, there was not a change in taxes in Chile. And real price increased by 18%. Why? Because the British American Tobacco chose to increase prices. Why? Because we all know that, or at least it's well known, that if a good has a price elasticity that is below 1, when you increase prices, you increase your revenues, because prices go up more than the decrease in quantities. So actually, you gain more money by increasing prices in a good that is inelastic, such as tobacco. So in this period, British American Tobacco increased real prices by 18%. There is not a single article in the press or by the British American Tobacco complaining about contraband in this period. Complaints about contraband started in 2010 when the government increased taxes. They increased taxes by around 10%. The increase in prices was far higher than 10%. It was almost 60%. But they started complaining about contraband. In the last increase in taxes, the increase in real price was also 16%. It was less than the increase in prices here. And they started complaining about contraband, again, because it was the increase in price was caused by taxes. So the question is, why contraband is a problem here and not here? Only because here they chose to increase prices, and here they were forced to increase prices. That's the only reason. Now, another thing to consider, and I'm finally, yes. First, tobacco taxes can not only generate revenues, but also increase human capital investment. A recent paper shows that in the case of Chile, and when we compared households that consume tobacco with households that do not consume with tobacco, households that consume tobacco, if they were forced or they chose not to consume tobacco anymore, they could increase investment in education by 16% of the household budget, and health expenditures in 32%. So basically, this is an indirect link, but I think it's quite clear between tobacco expenditures and human capital investments. And following that indirect link, we can pursue that and end up with economic growth and poverty. Now, there is no upper limit to tax increases. And Rosa mentioned this should say 75%. But the 75% threshold proposed by WHO is just that, it's a threshold. It was good to put that at some point to kind of show a mark to some countries. But now that some countries are approaching to that threshold, and some of them have passed that threshold, that number is a bit uncomfortable. Why? Well, because the tobacco industry is saying why you are increasing taxes above the 75% proposed by WHO. Why we need to increase more than that if we already are farther than that figure. It's a bit uncomfortable. I think that we have to somehow move these thresholds from tax shares to affordability, and Rosa mentioned also something like that. We need other kind of indicators to advance our case. And the last thing, and this is also a small critique to WHO, is that these tax thresholds should be re-estimated not to include VAT. And this is a case for Chile. It's in Spanish. Basically, in the case of Chile, says that taxes are 80% of the final price of the most sold brand, but that 80% includes VAT, which is about 16%. VAT shouldn't be included there because it's a general tax. Milk also pays VAT. So VAT, because it's applied to all goods, it doesn't change the relative price of goods, and it doesn't change any decision by households. We should consider only those taxes that are imposed to certain goods to change the decision of households related only to buying that certain good. And in that case, VAT shouldn't be there. If we take out VAT, the case of Chile, that is above this 75%, would again be below this 75%. So it's small. It says here, no, well, I stopped there. Thank you very much.
Thank you, Guillermo. We have one last speaker. When we talk about illicit trade, we have certainly a case in South America that is the embodiment of the controversy around raising taxes and illicit trade, and that is the whole Mercosur area. So Roberto is going to talk about particularly whether, by studying the Brazilian case, we can infer if tax raises could actually increase illicit trade and hamper further increases.
Disappear. ¿Y hombre desapareció? ¿Se fue? Aquí. Okay. Okay. Aquí. What happened? Okay. Thank you for the invitation, and I forget to include the no conflict of interest, so I don't have any conflict of interest. I have been working for tobacco and for tobacco control cause for many years. I have a long presentation that I will reduce, but let me say something about the ideas. I think that one question that we have to discuss is about what is exactly sustainability and what mean by sustainability. Then I will just discuss briefly the illicit trade and the current problems of tobacco taxation in Brazil. And I will discuss present some facts of the recent facts of tax policy and show some problems with recent tax and price increases and effects on sales, and how, in my understanding, Brazil has to move its tax policy from now on. Just very quickly, when we talk about sustainability, we have to talk about instruments. The instruments are some of the issues that Rosa and Guillermo discussed, the increased tax shares on price, and I'm at 75. But you also have to consider indexation to inflation and real GDP per capita. Another important issue in terms of preventing strategies of the industry is the simplification of the tax structure and improvement in tax administration to reduce tax evasion. And in terms of policy outcome, we have to look at the reduction of smoking prevalence, the increase of the ratio of tobacco products to personal income, the affordability indicator that we have been discussing, and we have to look tobacco tax revenue because this is a name of the authorities. Brazil, just in very few words, has increased tax rates since 2009 till last year, 2016, but without an automatic rule of indexation, as Colombia has established, which is, I agree, is a great idea. Brazil has simplified the tax structure and has a good system of domestic tax administration. The tax policy has contributed to reduce smoking prevalence in the country, with other policies also implemented. However, real revenues increased from 2011 to 2014 and declined since then, despite annual tax increases. And the last question is, the smuggling has been a growing problem in the country. Now, tax authorities are trying to define how to continue with cigarette tax policy. So, in fact, now we have a problem of sustainability, with how we move the tax policy forward, how we make progress in terms of tax policy. I agree that a good indicator of the success of a tax policy is the relation between prices to personal income of the population. So this is an indicator of affordability, and here you see that Brazil has increased, is this? Ok, aquí, esto aparece. Bueno, no importa. Okay. Brazil has increased the ratio of prices to income from 1.5 to 2.1. It's a big increase, but cigarettes are relatively cheaper in relation to income in Brazil. Okay, you see Costa Rica, even Mexico. Mexico has increased the ratio of prices to income after the reform, and despite that has not reduced the prevalence in the country. And cigarettes are relatively more expensive in Mexico, in Costa Rica, in Thailand, South Africa. So these are all middle-income countries, and most of them has higher ratios of prices to income. Ahora mira, sí. Okay, so first important increase, but the prices are still cheaper given Brazilian income. And that's the main question. The industry is saying that because prices are high in Brazil, there is an illicit trade, but we observe that in this comparison, Brazil has lower indicators of prices to income than countries as Mexico, Turkey, Thailand, and South Africa. Okay, just in very brief way. The blue line is the revenue. So the blue line is sales, total sales in the country, and you have a decrease after 2011. In fact, the government has been increasing cigarettes since 2009, but in 2011 implemented a new system with automatic indexation, as I said, and there was a big decrease in sales. However, here you have, revenues increased till 2014 and decreased after that. Okay, here you see the reduction of prevalence and the increase in real prices. So from this point of view, the reform was a success. Okay, here is a presentation about the survey that we made in Brazil, trying to define the size and of the illicit trade to measure, and the main conclusion is from the main conclusion is that the size of illicit trade increased from 16.6 to 31.1 in 2013 after the reform. So there was an increase of illicit trade. There are some limitations of our survey, and we are doing, with other colleagues, we are doing other analysis, and we are trying to prepare a survey of consumers and litter packs in main cities to define, measure better the illicit trade. Okay? This is something terrible that happened in recent years. You have, in the first column, you have the tax increase, okay? Then you have the reaction of prices, and see, this all is in real terms. Here, the prices increase less than taxes in both years. There was a contraction of GDP, and in the green column, you have the expected decrease on consumption, and in the yellow column, you have the effective change of consumption per capita. So the main message of this slide is that there was an effective decrease of consumption much bigger than the expected decrease, considering the increase of prices and the decrease of income. And so people are running from legal cigarettes, and they are not reducing consumption. There is a small decrease in prevalence. So the result of this, that people are running from legal cigarettes to illegal cigarettes. And of course, our measures of illicit trade in 2015 and 2016 are higher than the measure of 31% that I told that it happens in 2013. Okay, just to end and to have the time for the questions, of course, the sustainability of the tax policy has a main challenge in Brazil, and is the challenge of reduce and deal with the illicit trade. And in my opinion, we need to implement similar taxation levels and production controls in Paraguay. There is a Mercosur, which is an economic agreement, has not enough power, has not shown enough power to do that. And there are historical obstacles to the discussion with Paraguay, but Brazil is a main economic partner of Paraguay, so Paraguay has incentives to reduce smuggling and discipline itself, and Brazil is the main beneficiary of formalization of Paraguay, because can charge taxes and reduce consumption of illicit products. So I think that just to end, I end finally. Just to end, diplomatic economic negotiations are necessary to reduce smuggling. So here, just as a last comment, tax policy has a new challenge, and it happens in Brazil, on countries like Vietnam, who has illicit trade coming from the neighboring countries, from the production from another country which goes to Cambodia and Laos and enter in Vietnam. We have to consider, as in order to maintain sustainability, to go to another level of movement, which is the discussion of diplomatic and economic negotiations to solve the problems of illicit trade, such as Brazil or Vietnam or other countries. Okay? Just thank you.
So we're going to open a brief 5 to 10 minute period of questions and answers. Something that Roberto did not mention, for those of you who are not from our region, the problem of Paraguay is really serious, and to the point that the president of Paraguay is the owner of the most important tobacco producing company in the country. So there you have a challenge. Okay, so questions for our speakers? Yep, Tanya, and please. 2 years.
Thank you for this brilliant presentation. A lot of news, a lot of challenge for us, mainly we from Brazil. We know that the issue of increasing tax and prices is a real challenge for us, considering the issue of the illegal market of cigarettes. But I'd like just to ask some question for Guillermo and Roberto. You mentioned that, let me see what my thoughts. The prices are formed by taxes and the cost of production. As you know, Roberto has shown that in Brazil there was a big increase of taxation, but this didn't repercute it in the prices, proportionally in the prices. Did you consider the power of tobacco industry to control the whole productive chain, the whole supply chain, as a way to deal with the increase of taxation without passing it for the prices? Because we know that in Brazil, several tobacco industry like BAT, Philip Morris, China Monopoly, Japan Tobacco, they use to control the production, the agricultural production of tobacco leaves. And they decide for the price that they pay for the tobacco leaves. So my question is, if you consider this power to control the final price they pay for the tobacco leaves, a way to deal with the tax increases without passing it to the final price of cigarettes? This is one question. And I'd like just to add some new elements in the issue of illegal market in Brazil. The last news that we had is that for the first time, the president of Paraguay looked for the president of Brazil to negotiate some questions related to drugs dealers. And Brazil succeeded to put the cigarettes smuggling in the agenda. But the main problem is that the reason for that is that the biggest drug dealer of Brazil that is responsible for smuggling drugs and drugs dealers and weapons is taking care now of cigarette smuggling. So this is a huge problem for Brazil beyond Paraguay So Paraguay is feeling threatened by this new element of this PCC. This is a huge organization of drug dealers and armed weapons that are now putting cigarette smuggling as the first one in the business of their business. So this is one new element that we have heard very recently that I'd like to share with you because we are very frightened with that. Thank you. Sorry.
Tanya, just a question. In relation to Brazil and cigarette costs, historically, cigarette costs in Brazil were cheaper than in the rest of the region. And I think that there are two reasons for that. Brazil has a big tobacco production, and the cigarette producer is also owner of the factories of tobacco leaf processing. So it's clearly a problem of control of the chain and lower historical cost of tobacco processing and the second factor is there is a huge market, and there are some cost reduction because of the size of the market and the size of the factories. So it's possible that, and I agree with you, that the industry use the cost in order to make their strategies to react to tax policy. But it's true that Brazil historically has a lower cost, lower than the other countries.
My name Abdillah from the University of Indonesia. My research area is tobacco tax. I have several, maybe it's quite detailed question. Yeah. First is, because this is a very rare opportunity to have the Latin Americans tax on tobacco. First is regarding the price of cigarette. What is the variation of the price of cigarette in your country? Because in my country, the difference between the cheapest and the most expensive is very wide. It's very wide. That is the first question. Yeah. This wide variation of the price result from the complicated tobacco excise system in Indonesia. And then the next question is, what is the industry profile in your country? The industry. Yeah. In Indonesia, we have 700 producer, 20 big player. Yeah, we have Philip Morris, we have Kratex also. So this complicated industry will result in the complicated system. We have very structured. There are 12 tier in the system, so it produces very wide price, and it is not efficient. And this is the second question. So the third question is regarding between tobacco tax and tobacco excise. Is it the same in your countries, or it is a different thing? Yeah, the tobacco excise and tobacco tax. In Indonesia, tobacco is excise. It is under the law of excise. My question then is regarding the extensification. What kind of good and services that is excise in your country? Yeah, because Indonesia is very quite depend on 8% of the revenue come from the tobacco excise, because only two goods excise, tobacco and alcohol only. How about in your country? And then Brazil, you explained about the simplification. Can you explain more about what is the simplification in your tax system?
Okay, so
I'll try to provide an overview of what's the situation of the region in Latin America. Of course, it's not going to be very precise, but I can give you some answers. So in terms of wide variation at country level, it's true in most countries in Latin America, there's also a wide variation between the cheapest and the most sold brand and the luxury within each country. Just as I showed the variation among countries, there's also variation within the country. The industry profile in the Latin American region, it's either Philip Morris or BAT, and they basically have divided the Latin American market. So in countries where Philip Morris is, BAT is very small. In countries where BAT is, Philip Morris is very small. So they dominate countries, and I would say basically half and half. Only in a few, they're mostly not. In Uruguay would be an exception. Yeah, but it's basically an exception. It's mostly Philip Morris and BAT. Tax structures, from the little I know about Asian countries, I would say that Latin American structures tend to be less complicated than the Asian ones. Not many countries have tiers. Many countries apply excise taxes only to cigarettes, not to other type of tobacco products. And when they apply to cigarettes, with the exception of Brazil and how it was in Brazil in the past, it's just to all cigarettes the same. There are no many complications in terms of tiers like I've seen, for example, in Philippines, or that like it used to be in the Philippines. Yeah. And in terms of excise taxes, in many countries, yes, the excise tax that it's applied to tobacco, it's also applied to alcohol and gas. How do you say gas? Gas and gasoline. You know, it's the same. It's the same one.
And I would say that in most countries of the Latin American region, taxes or excises are ad valorem, which also contributes to this wider dispersion of prices, and basically also provides an incentive to tobacco producers to play with this differential pass-through of taxes. So basically what they do, because of the tax structure that is ad valorem, they fully pass the taxes to the more expensive brands, but they have a pass-through that is less than one for the more economic brands. So basically what you do in that case is that you provide substitutions to the people. That they can down trade, which is not, of course, ideal.